So much. Really happy and excited to bring together a wonderful group of people who we're going to hear from. Let me introduce myself. I'm Christine Ashley, and I serve as Down Home's campaign coordinator for Medicaid expansion. I want to welcome all of you and thank you for taking the time out of your really busy lives to join this really special rally. In a few minutes, you're going to hear some personal stories about what it looks like and feels like when you're part of the healthcare coverage gap in North Carolina. Who's in the gap? Well, over 600,000 people in North Carolina have no access to healthcare. And we're talking families and farmers, caregivers and childcare workers, veterans and their families, hardworking people who earn too much money for Medicaid, but not enough to afford any other forms of insurance. So with this kind of coverage gap, North Carolina is in a healthcare state of emergency. So tonight we mobilize because we know how Medicaid expansion in North Carolina is going to help hardworking, low-income families who need the security of quality health coverage to get life-saving care when they need it without facing huge medical bills. So I'm honored to introduce Mary, Fabiola Rosalva, and Rosalva's son. We're waiting for one speaker named Lourdes who may not be able to join us today. And of course, Nico, who has joined our Down Home staff. These are all our speakers tonight. And these 4 people are going to share some personal stories that make really plain exactly why we need to close the healthcare coverage gap here in North Carolina. So after you hear these 4 stories, we're going to introduce Dreama Caldwell, who is our executive co-director, and she's going to be asking each of us tonight to commit to taking an action. We need all of us to ensure that our legislators write Medicaid expansion into North Carolina law and budget. So we're going to ask you to visit our website at dhnc.org/Medicaid and decide what your next step will be. So thank you to all of our speakers for taking the time to share your stories with us. We're going to start with Mary. Mary, if you can share your name and who you are and why you believe in Medicaid expansion.
Right. Is there something I turn on so that I come across the screen, or no, we just speak?
Yeah, if you're on a computer right now, Mary, you can go down to probably the bottom of your screen. You'll see a microphone and it says video. If you click the video, we might be able to see you.
I can't see that because I don't feel like I'm in my normal Zoom. Let me go to Zoom. Yeah. I'm sorry. I'm holding you up now. This is terrible.
It's all good.
Doesn't matter. Doesn't matter. I'm just going to talk to you. Okay.
Sounds great.
Okay. Hi, everybody. My name is Mary Dooley, and I live in Orange County, North Carolina. I'm a registered nurse. I'm retired, but I always keep that license up because you never know when you might need it at a health fair or a community gathering for volunteer work, which is what I'm doing at my age now. I'd like to talk to you about Medicaid extension from the perspective of someone who does healthcare work or did healthcare work, and as a patient myself. I became a type 1 diabetic at the age of 11 and started on insulin. And as the oldest in a large family, that really blew my family away. It's a costly disease between your syringes, your needles, your insulin, and this is before the outrageous prices that diabetics face today, and testing materials. It can be absolutely devastating. And this was before, because I'm quite old, this is before there was any kind of Medicare, before our government voted that into being. But anyway, we got through it. And about 6 years later, I decided to become a nurse. And I think it was because I wanted more knowledge and power over my situation that I made that decision. I went on to work in many different environments, starting with hospital care, moving into health clinics, community health programs, and then ultimately doing research. And my favorite thing was that I wanted to do global health. And I got to do that. I went abroad with a group called Médecins Sans Frontières. It was before they had the American Doctors Without Borders, so it was a while ago. And issues of healthcare access are just phenomenal all around the world. But what was most shocking is when I got back to America, decided I needed more education to do what I was doing. I wanted to do a master's in public health, applied, worked for a while to get myself established and pay for that. And I then got the student health insurance. I had a bleed in my eyes, which is something that does happen to diabetics who are not as strictly managed as I probably should have been. I had to get treated at the hospital. It was at the university hospital where I was doing my degree. And then saved my eyesight, thank goodness, and then got a whopping bill like you would not believe. And I was in despair. And I met someone on the bus going into work. He was a doctor, and I told him my situation and that they were also threatening not to give me my diploma if I didn't pay my hospital bill, because remember the universities and the medical school and the hospital were all linked. And so this guy got me my case transferred into what was called medical teaching funds, which wiped out my bill. Now, how freaky is that I had to meet some kind, ethical doctor on a bus in order to graduate from school, in order not to be in debt or to go into bankruptcy. I do have a sister who went into bankruptcy following bladder cancer. These things are just sort of insane in a country with as much money as we have. Our healthcare system costs more than anywhere in the world, and yet our maternal mortality rates, all these things are still very, very high. And as far as the gap, the British say, mind the gap. Well, we really need to do that here because Medicaid was established under the Affordable Care Act to help our most vulnerable and least wealthy patients get adequate care. We in North Carolina, we're one of 12 states that refuse to accept that care. Go figure, okay? More than that is that the qualifying levels are so low that most people cannot get this despite working 2 and 3 jobs. Sometimes they still do not make enough that they can get by to pay for their medication and whatnot. And if you do make too much, you don't qualify to get the health insurance. So that's what we mean by that gap. There are more and more middle-class people experiencing the gap, if you like. People who are working very hard, they're not yet to 65 where they can get that Medicare, and darn, the cost of medication, the cost of medical services, as several of my friends say, we just don't go to the doctor. We just don't go get care, which in the long run does not make for a very healthy society. So I want to thank you for listening to my little personal story here, but I think I would like to support the idea that we make sure our legislators accept extension of Medicaid funds, and that we close that gap for the many who fall in between the lowest income people in our society and those who can afford regular health insurance. We are good people and who believe in doing the right thing. And that includes accepting and extending Medicaid in North Carolina. And I thank you so much for listening to my personal issues related to healthcare and sometimes difficulty accessing it.
Thank you so much, Mary, for sharing your story and really helping us know where you as a person and as somebody who's a community health organizer and nurse have been hit by this healthcare coverage gap. Right now, I want to invite Rosalvo to go ahead and unmute. And Rosalvo, maybe you can explain a little bit about where you and your family work and how the healthcare coverage gap impacts you. Are you able to unmute, Rosalvo? Oh, sounds like it. Thank you. I think we heard you right there. Yep, you're ready. We hear you.
Hi, well, my name is Rosalba Esparza. Ahorita estoy trabajando in this moment I work for Pender Chronic Christian Services. Ayúdame. Help me, can you help me, Kathleen? Ven, ayúdame. Excuse me, I'm sorry. Ayúdame, sorry. Hey, sorry, I'm gonna be translating for my mom.
Hi, Fabiola.
so
Thank you.
Sorry, I just got home from work. But yeah, pretty much my mom, she works at Pender County Christian Services. Before that, my parents, they're migrants and they work in the agriculture, pretty much like picking strawberries. They're out there daily, in the hot, and it's something stressful because for them that they're still not like residents here in the US, like it's hard for them to get health care. And if they do go to the doctor, like it's a lot of money. And it's hard for them because they're like, we want to get checked just in case something is wrong with us that we may not know of. They want to go get that checked out, but sometimes they're like, no, but then we're going to have to pay all this money. And it's hard too because they're having other bills and, having to provide for us, like me and my siblings too. And it's hard for them because, they wish they had that healthcare and that help that everyone else has, but it's a little hard to for them to have healthcare and have all that type of stuff. Como nosotros había mucha gente que no tenemos los documentos y no tenemos acceso a un seguro médico también. And like there's many people out there just like them that they don't have access to that health and medical help that other people get provided. Bueno, y nuestra situación cambió un poco porque, pues gracias a Dios, ahorita tenemos. And like for them at the moment, it might be changing a little bit since they are, in the process of becoming residents and citizens, and hopefully that'll help them out to eventually one day tengamos acceso a un seguro médico, to have access to like medical help too. Sí trabajamos, pero pues todos, como dijiste tú, se nos dan los pagos y. And like I was saying, they work every day on the daily, and everything pretty much goes to bills. And, sometimes it's hard to be able to pay for all that medical stuff that we may need one day. Nadie en nuestra familia lo tenemos, por eso sí nos gustaría que algo cambiara, ¿verdad? Que se pudiera hacer algo, porque nadie de nosotros tenemos el seguro médico. And we wish that one day, all of us could have that medical help because at the moment, none of us do. And pretty much we pay for, all of our medical stuff that we may be needing. Pues nuestra historia es mucho más, ¿verdad? Pero para platicarla así, dile que. Sí, dile, eso fue la diré que nuestra historia, pues es como mucha gente la tenemos, ¿verdad? Nunca hemos tenido acceso al seguro médico, sí nos gustaría que cambiara todo y pues no sé qué más podemos decir. And so yeah, we're all forward to helping out and trying to help this organization become something, and we're all forward for it, and we're here to support everyone and support each other too.
I have one question for you, Fabiola, which was what is your healthcare situation?
I don't have any healthcare at the moment. And it is hard because, you know, sometimes I do have to go in and pay for my medication and like, you know, like I'm a full-time college student, but at the same time I do have a part-time job and it's hard to, you know, manage both and then being able to pay my own bills and help my parents out too around like with certain bills that we might have. And it is hard because, you know, like if I'm sick or if I feel really bad, like I'm just like, no, like is it really worth going to the hospital and having to pay all that money that I may not have at the moment? And so like it's really hard for me. That's why I'm just kind of like, and for my brother too, you know, like it's hard for both of us because we don't have any of that medical help at the moment. And it's a lot, you know, like it's hard for us to be able to put some money aside for that help that we may need one day. Like you never know what could happen in the future, and like having to be in debt for something that it's not completely our fault in our health. Even if we're, you know, we were born here in the US and everything, we still don't get that help that we may be needing.
Rosalvo and Fabiola, I want to say thank you so much for coming in tonight and joining us and letting us know the situation of your entire family who are hardworking, have been working on farms. You're a college student, and I know you've got another part-time job, and you also, I think, help out on the farm as well. Thinking about you and your family, and we are here to ensure that this healthcare coverage gap is going to be something of the past over this next budget. So I want to say thank you so much for joining us.
No, thank you.
Thank you.
So we're going to pass on to Nico and then conclude this program with some words from our executive co-director, Dreama Caldwell.
Hey, all, Steve. I've had a little bit of so if you're not able to hear, just hearing me, that'd be great. So hey, my name is Joe. I use he/him pronouns on the Medicaid expansion team as a deep canvas lead trainer. I want to talk a little bit about my dad. I lost dad in 2013. He was in what we've been referring to tonight as the Medicaid gap. The Medicaid gap is when a person makes too much money to qualify for Medicaid, but not enough to afford health insurance. So I want to start by giving you a brief biography about my dad, just for some context. Dad was a first-generation college kid. He was from a working-class home in a small Indiana town. He worked his ass off to earn his bachelor's degree in psychology, and he used it to get the hell out of Indiana. He would go on to receive a master's in mental health management. He earned his graduate degree on the weekends while raising a family and working a full-time job during the week. Eventually, he would take a job in Yadkinville, North Carolina, as the director of an outpatient mental health facility and drug rehabilitation program. The facility was in a one-story hospital called Hoots Memorial, or Hoots for short. Hoots was a busy small-town hospital with a med-surg unit, an ER, and an OR, mostly for emergency and outpatient surgeries. I even worked there as a janitor while I was in high school. I think my sister also worked there as a janitor while she was in high school too. Dad kind of thought of himself as like an Andy Griffith character. His kids hung out around the office, learning life lessons while scrubbing toilets and cleaning the OR. Dad's behavioral health program was very successful. Made a lot of money for his Memorial Hospital. He ran that program for almost 20 years before the hospital decided to end their contract with his department. Hoots Memorial was experiencing some financial crisis from a broken contract with a for-profit company that was contracted to revitalize the hospital. The details of this financial disaster are written about in articles online. I've read them. I still don't fully understand what happened. Shortly after this, in May of 2010, Hoots Memorial Hospital shuttered its doors. Dad had a lot of health issues at this time, including type 2 diabetes. He could manage his illnesses with proper medications and regular doctor visits. For the first few months of unemployment, Dad paid for Cobra to keep up with his insulin and his anticoagulants, as well as his antidepressants. He looked for work and went to job interviews. He cashed out his 401k. He somehow depleted his life insurance. He got a lot of rejection emails from potential employers. He got behind on bills. He went underwater on his mortgage. He became really depressed. Then he became despondent. I'll probably never know exactly when Dad stopped being able to afford insulin. I can't remember when my sister and I started sourcing insulin for him from other family members. I can't remember when I found out his house, the house my sister and I grew up in, was in foreclosure. I do remember staying up all night at Baptist Hospital after Dad swallowed a bottle of pills. I remember the note in shorthand: no life insurance. Cremation is cheaper. Dad survived that suicide attempt, and as the date of vacancy drew closer, we moved what furniture we could into my 2-bedroom house. We packed Dad up and sent him to Indiana. The man from the bank came to do an inspection of the house and collect the keys. Eventually, Dad would move in with my sister in Georgia in late 2012. My sister came home one day to find Dad on the floor of her guest room. Barely able to talk, he told her, "I didn't do this to myself."
Nico,
He
I
had
think we
suffered two simultaneous at Dad's bedside.
Nico, I think we lost you about like 15 seconds ago.
Okay, yeah. Do you remember exactly where I was at? Around
Yeah, I think it was surviving
in
first.
the body.
Mhm.
Great. So I'm gonna avatar I have. He drew closer. We moved what furniture we could into my 2-bedroom house. We packed Dad up and sent him to Indiana to live with his mom and stepfather. That was the same day the man from the bank came to do an inspection of the house and collect the keys. Moved sister in Georgia in late 2012. My sister came home one day to find Dad on the floor of her guest room. Barely able to talk, didn't do this to myself. He had suffered 2 simultaneous strokes, and his kidneys were failing. My sister and I spent a month in the ICU. Eventually, it became clear that Dad's quality of life wouldn't be worth the constant care that might only sustain him for a short time longer. My sister and I decided to begin palliative care. It feels great to add Dad's story to the other stories about people who have suffered because of the North Carolina Medicaid gap tonight. Oftentimes, when a group of people get together and share grievances about an issue, it can feel a little like a support group session. But I think that the support that we need is for all the folks here tonight to fight for Medicaid expansion in North Carolina. If we work together towards policy change in our state, we can close the Medicaid gap. I believe it's stories like the ones we're telling right now that will expand Medicaid this year. And up next is my boss, Dreama, tell you how you can help us join the fight. Thank you so much. Dreama?
Thanks, Nico. Hi, y'all. I'm Dreama Caldwell, and I'm the executive co-director of Down Home, North Carolina, and we are Down Home. And at Down Home, we believe that all deserve health care. I'll say that again, we all deserve health care. And that's why we believe what we just heard from our speakers, Mary, Fabiola, Rosalvo, and Nico. And I want to thank them for their stories this evening. I want to end this rally by underscoring how urgent this very moment is. For the opportunity right now to close the Medicaid gap for 600,000 North Carolinians who all want the right to protect their family, their neighbors, and themselves. We need to bring our everyday, ordinary selves and stories to our elected officials. We can make Medicaid expansion a part of our state budget and our state legislation. Now it's time to close the gap, the coverage gap. Would you help with those efforts? Could you check us out over at dhnc.info/Medicaid for next steps? We're here ready to provide training and community resources to make sure that we close this gap. Come on in, y'all. We've got work to do.
Thank you, everyone, for a really profound evening. Thank you for holding us as we went through our first statewide rally to expand healthcare in North Carolina. Wanted to let you know that we've got a link up on the chat for you all to go ahead and take that next step. dhnc.info/Medicaid with a capital M. I hope you stay healthy and safe, and let's get it done.